In this video, we're going to start going through proper exercise technique. Most people don't realize that 80 to 90% of any exercise you'll ever perform is going to be a combination or a version of a few basic movement patterns. Throughout the program, we're going to teach you how to do proper technique on every single exercise. However, we like to start out by teaching some of the most common mistakes as well as proper form and technique on these basic movement patterns. I want you to watch this video and practice along with it. And this is really important because we want to start with a really good foundation of good exercise technique, and it's going to pay big dividends as you move through our exercise programs.
Squats. So with this, the most important thing is you're bending at the knees and the hips, and you want to keep the knees straight ahead and not moving left to right if you're looking from the front view. From the side view, you want to see how you're really getting the hips back, you're really sticking butt out, but at the same time, you're keeping the chest up tall. Most common mistakes we see, oftentimes people won't be getting the hips back far enough. They're going to be pushing the knees forward like this. Also, a lot of people won't stay up tall through the upper body, so they're going to be bending at the waist like this. You also want to watch for those heels coming up off the floor. The heels should be on the ground the whole time unless otherwise specified. And you want to make sure you stay flat through that upper back and nice and tall. You're not rounding through the upper back. And one of the most common ones, especially in females, is the knees caving in together like this. Make sure they stay nice and straight.
To review, what we want with good form is reaching the hips back, weight on the heels, pushing up through the heels, squeeze the glutes at the top, and staying nice and tall with an open chest on the way down.
Next, we have your push patterns. So this can take a lot of different forms. It could be a chest press or chest fly or push-ups. So with this, there's a few important things. So for good form, each time on the way down, you want to pull the chest open using the shoulder blades. So really pretend like you're pulling the chest or the rib cage open each time. You want to make sure you keep a nice big chest, big rib cage, and you want to keep a bit of tension on the abs to make sure you keep your spine in a nice neutral position. Big mistakes, or most common mistakes, are not pulling the chest open with the shoulder blade. This tends to cause the front of the arm to move forward in the shoulder joint, which can cause pain and problems. Another common mistake are the shoulders shrugging up towards the ears. You really want to watch for that and make sure that the shoulders staying down nice and low away from the ears. And you want to make sure you're doing a full range of motion, getting the hands beside the chest and not cutting it. Some people, depending upon their spine position, might find that they can't reach their head down to the bench. For this, if you find that is happening, put a towel underneath your head. And really important, you want to maintain the right spine position. So you should have a natural curve in your lower back and keep the tension on the abs to make sure you're not increasing that curvature as you press.
To review, what we want for a chest press is pulling the chest open with the shoulder blades with a full range of motion going right down beside the chest and then pushing the elbows straight each time, keeping a nice big rib cage and keeping that lumbar curve by tightening the abs a little bit.
Next, we have pulls. So with this, you want to make sure you have a nice big rib cage again, flat back, and you want to be pulling from the shoulder blade. Your arm is helping the shoulder blade out. So really squeeze that each time. Think about the shoulder blades pulling that rib cage open again, just like the push pattern. One common mistake is people just pulling from the arm, which again causes the front of the arm bone to be pushing forward in the shoulder joint and can cause risk of injury. You want to make sure the upper back's not rounded on you. You want to keep it nice and flat, long spine. You really want to watch for that head. The head will have a tendency to want to pop forward as you pull. Try to keep it neutral. And you want to make sure that the spine isn't moving. So you don't want to see big rotation like this. You want to keep the back nice and flat.
To review, for the pull, what we want is to keep a nice big rib cage, flat spine, and then pulling from the shoulder blade, squeezing the shoulder blade each time, trying to pull the chest open.
Your lunge pattern next. You'll see this in lunges and step-ups. So what you want is the hips moving like an elevator, straight up and down, staying nice and tall through the rib cage like you're balancing a book on your head, pushing through that front heel up on the toe and the back foot. Common mistakes is that front knee caving in. You want to keep it going straight ahead, lined up with the toes. Another common mistake is the back foot being too wide. So you want to make sure that it's straight back and you don't have that wide stance. Often people's hips will move like an escalator where it's moving down and forward. Try to be more like an elevator. Make sure that you don't get too close of a stance with your feet. You're getting a nice big step back. Make sure you stay nice and tall through the upper body. You're not leaning forward through with the upper body. And finally, make sure you don't get too much weight on that back foot. This will often happen if you take too big of a step. You should have 70% of your weight in the front.
To review, what we want for the lunge pattern is the hips moving straight up and down like an elevator, pushing through that front heel, up on the toes on the back foot, and make sure you stay really tall through the spine. Pretend like you're balancing a book on top of your head. Nice big open rib cage.
Hip hinge movement pattern. This will be used for deadlifts and hip extensions. So really important, you keep a nice big rib cage, which will help keep the back flat, and you reach the hips back. You should feel tension through the back of the thighs and maybe a little bit of pressure through the upper and middle back from keeping that proper posture. And notice how the neck stays in line, looking down on the way down and up on the way up. Sometimes people have challenges keeping this position. If so, start from what we call the shortstop position. So just begin with the hands on the knees and work on hinging through the hips, reaching the hips back, keeping that big rib cage. And then you can slowly start to move farther down the legs until you can get the full range of motion. Common mistakes are keeping the knees too straight. You want a little bit of bend in the knees. If you keep them too straight, you'll round through that upper back. Turning it into a squat where they're bending too much from the knees. So you want a little bit of bend, but not too much. Your chest should be going over like you're taking a bow. And then neck position. Oftentimes people will continue looking up at the wall instead of looking down at the ground, and not keeping that upper back position, rounding too much through the upper back.
To review, what we want for the hip hinge is reaching the hips back, making sure to keep the back flat, the spine flat, keeping a nice open rib cage. You should feel tension through the back of the thighs.
Front planks. So you'll have a lot of different plank positions throughout this, so it's important for learning proper spine position. So you notice how the body's in a nice straight line from the ankles, hips, shoulders, and ears, keeping a nice big rib cage position. Whether you're doing a position from the hands or from the forearms, it's the same position, nice straight line. Common mistakes are the hips dropping too low, where they're sagging a little bit. This will put pressure in the lower back, or the hips being too high. You want to make sure you have them in a nice straight line. You want to watch for the head poking forward, or for looking up. You want to keep the spine again in line with a nice long spine, and you want to watch for that upper back not rounding on you. This will especially happen when you're fatigued. Commonly, people get pain through the wrists. A good solution for this is to hold on to a pair of dumbbells.
To review, for the front plank, what we want is a nice straight line through the body, through the ankles, knees, hips, shoulders, and ears. There should be a straight line. Make sure you keep the abs nice and tight and holding that position.
One of the trickier things for most new clients is the TVA, or the transverse abdominals. They're very deep abdominal muscles that most people can't use very well. So we want to take some time to go through and coach this, because it's really important to getting your core functioning properly. So you want to slide one hand under the lower back, and you should feel that natural curve. You want to keep that curve throughout this exercise. So you're going to pull your stomach in really skinny, like you're vacuuming it in, like if you're trying to fit into a corset or a weight belt, but maintaining that spinal curvature. You should feel the tension through the inside of the hips and the lower part of the abs. Something that can help is to grab the pelvic floor muscles at the same time. You want to make sure the spine doesn't flatten out, and you want to make sure that you don't get tension through the front of the abs.
So to review, for the TVA, we want to make sure we keep that curve or space between the ground and the spine, and you want the stomach vacuumed in, skinny as you can, with the pelvic floor contracted, feeling the tension through the insides of the hips.
We have the lower abdominals next. For this, it's very similar, but working different muscles than the TVA. You want to slide your hand under your lower back, and in this case, you want to flatten the spine by tipping the pelvis up. So you should feel that curve go away. You want to make sure you pull the belly button in so you're nice and relaxed in the middle, and you want to try to get tension on the sides of the abs this time. Commonly, what you're going to see is the middle of the abs want to tighten up and contract. You want to try to really pull them in to keep them relaxed and have the outside of the abs doing the work. Common mistakes: people often push through their heels to get the pelvis to tip instead of using the abs to tip them, or they commonly use the neck and the upper abdominals to lift up and flatten the spine out.
And to review for lower abs, you want to pull the belly button in nice and relaxed in the middle, flatten the spine out against the ground by tipping the pelvis, and you should stay relaxed in the middle, keeping tension on the side of the abs.
So those are all of our most important movement patterns. Feel free to go through and practice those again. We want to get these so they're second nature to you. We're going to go through and we're going to be coaching you on these patterns and really make sure you're getting proper technique, because it's so important, not only to get the most benefit out of your exercise program, but also to minimize your risk of injuries.